Hi, I'm Rachel, here with Student Nurses Station. In this video, we are going to look at a nursing care plan for a patient with COVID-19, so stick around. Let's begin with our assessment. Our patient is an adult male presenting to the emergency room with difficulty breathing. He states, "It's hard to even breathe." The patient is seen in respiratory distress. He is having labored and difficulty in breathing. Patient seen anxious and fearful. Patient reports loss of sense of taste, chills, and frequent high fever. He also denies any recent surgeries or hospitalizations. Patient admits to being a heavy smoker, smoking about 2 packs of cigarettes per day for many years. Now let's go over subjective and objective data. First, let's look at subjective data. So what is the patient telling us? Patient complains of chills, high fever, cough, cold, and flu-like symptoms. The patient also reports fatigue and shortness of breath, especially with exertion. Patient reports loss of taste and smell. No hemoptysis, dysuria, nausea, vomiting, or diarrhea. Denies pain, edema, or changes in bowel movements. Now, let's look at objective data. We have vital signs. The patient's blood pressure is 160/100 mmHg, pulse rate is 130 beats per minute. Temperature is 38.3 degrees Celsius and respiratory rate is 26 breaths per minute. Patient's SpO2 is 92% on room air. Physical assessment, head and neck. The patient's head and neck are within normal limits, except for congestion and rhinorrhea noted. Chest, bilateral crackles on auscultation, increased work of breathing. Patient is using the accessory muscles. His intercostal muscles are retracting and he is exhibiting nasal flaring. Patient is in mild respiratory distress. There is no jugular vein distension. Heart sounds are regular with no murmurs, rubs, or gallops. Abdomen is soft and there is no masses, tenderness, or orgonomically. Skin is warm and dry. Patient has COVID-19 or SARS-CoV-2, positive confirmed by an RT-PCR test done at an outside facility. Now let's look at our diagnosis. Our number one priority is impaired gas exchange related to COVID-19 infection, as evidenced by labored and difficulty in breathing, increased respiratory rate, and decreased oxygen saturation. Planning for planning, let's look at our goals. Short term, after 8 hours, the patient will exhibit improved respiratory function as evidenced by a respiratory rate within normal range, 12 to 20 breaths per minute. SpO2 greater than or equal to 95% and decreased dyspnea. Long term, after 5 days, the patient will maintain adequate gas exchange, as evidenced by tolerance to activities of daily living without worsening shortness of breath. Interventions. Let's look at independent, dependent, and collaborative interventions. We're going to start with independent interventions. First, acknowledge the patient's fear and anxiety. Offer reassurance and calm communication. Monitor and document blood pressure, pulse rate, respiratory rate, temperature, and oxygen saturation. SpO to every 1 to 2 hours or more frequently as needed based on patient condition. Observe for signs of labored breathing, use of accessory muscles, pursed lip breathing, and nasal flaring. Assess for fever, chills, white blood cell count, and other indicators of infection. Elevate the head of the bed, hob, at 30 to 45 degrees to promote easier breathing. Encourage use of pillows for proper positioning. Teach and assist the patient with pursed lip breathing and controlled coughing techniques to help clear secretions from the airways. Monitor and document respiratory status, including respiratory rate, depth, and effort. Encourage adequate fluid intake to maintain hydration. Provide frequent oral care to moisten the mouth and throat. This will promote comfort and reduce irritation that can worsen cough. Provide emotional support and reassurance to alleviate anxiety. Now let's move on to dependent interventions. Apply nasal cannula or other prescribed oxygen delivery devices to maintain SAO to greater than or equal to 95%. According to physician's orders, monitor oxygen flow rate and adjust as needed. Perform postural drainage if appropriate and with physician order. Assist with nebulizer treatments as ordered. Administer prescribed bronchodilators and other respiratory medications as ordered. Check with the physician for potential ventilatory support if needed. Administer prescribed antibiotics, antivirals, and other medications as ordered. Now, let's move on to collaborative interventions. Collaborate with a respiratory therapist to assess the patient's respiratory status. Develop a plan for oxygen therapy and provide additional respiratory care as needed. Communicate any changes in the patient's condition, including worsening respiratory distress, fever, or oxygen saturation levels below 92%. Collaborate with a dietitian to develop a personalized nutrition plan that meets the patient's needs and preferences. Collaborate with physicians for ongoing management and potential hospital discharge planning. Consult with physical and occupational therapists for rehabilitation if needed. Begin discussing discharge planning with the patient and family as their condition improves. This may include medication, education, home oxygen therapy instructions if needed, and isolation precautions. Moving on to evaluation. The patient was able to maintain a respiratory rate within the normal range, and the patient's SpO2 remained as greater than or equal to 95% on the prescribed oxygen therapy. After 8 hours of nursing interventions, the patient reported decreased dyspnea and improved breathing comfort, and was able to perform regular ADLs after 5 days of nursing interventions. You can replay this video to remaster and familiarize the COVID-19 NCP. Thank you for listening.